Okay, welcome to the April 22nd media briefing from Sacramento County Public Health. As a reminder, we will hear from some of our public health staff on some updates from COVID-19, and then we will take questions after they are done giving their update. So I will hand it over to Dr. Olivia Casirier.
Good morning, everyone, and thank you for joining us today. So with the numbers, we are at 101,665 cases of COVID-19 reported to Sacramento County and 1,647 deaths. We are continuing to average about 150 new cases reported per day. And the case rate is continuing to fluctuate, but is in general in the nines. And the 7-day average is also fluctuating as well, but no major outbreaks. It's mainly community spread. We continue to wait for word on the Johnson & Johnson vaccine. We're hoping that tomorrow we will have more information about how to move forward. But on the national level as well as statewide, we now have at least 50% of our residents having gotten at least one shot of the vaccine. So that is some progress, but we still have a long way to go in reaching more of our communities. So with that, I will turn it over to Rachel to talk more about our vaccine efforts in Sacramento County.
Hi, good morning. I have allocation numbers for you this week. So the allocation to our provider network is 23,130 doses, and that's a slight increase from last week. That's 10,530 doses of Pfizer and 12,600 doses of Moderna. And of course, we did not receive any Johnson & Johnson shipments or allocation this week. And I'll just add that we are still in the process of transitioning to the Blue Shield network. Most of our providers have transitioned at this point. There's only a handful left that we handle the allocation process for, and that's, I think, going to be wrapped up in the next week or so from what I understand.
Thank you very much. So with that, we can go ahead and move on to the question period. Please go ahead and utilize the raise your hand function in Zoom or the chat. If you are on the phone, then you can go ahead and speak up. And please identify your name and your outlet before asking your questions, and then we will get answers from our panel. Go ahead, Chelsea.
Hi, this is Chelsea Shannon with ABC 10. We have a couple of questions about vaccine hesitancy at ABC 10. What measures are you guys taking to combat vaccine hesitancy? Are you putting any programs into place to gather influencers to help spread the word about getting vaccinated? What percentage of people in Sacramento that have been vaccinated so far, and what magic number do we need to get in order to reach herd immunity?
There are many questions there, Chelsea. So
yeah,
I'll answer the first two questions. My name is Mike. I'm with Sacramento County Public Health. And how we're working, we're continuing to working with our community-based organizations and leaders, in addition with our health system partners to really combat misinformation around vaccine hesitancy, really leveraging our trusted messengers to really understand what is the specific need, what's the best medium, and what's the best way to really address some of the issues. And then in terms of program, there are specific programs, and it looks different for each community, particular communities of color, and the diverse demographics of our county. So we are working alongside a lot of our community-based organizations to find ways to address some of those. And then the second two part of your questions, I'm going to pass it over to my colleagues in terms of the percentage.
Amy, do you want to take that one?
So I think we're working on figuring out exactly, Dr. Casirier and I were talking this morning about doing some mapping of different areas and to see what the distribution of proportion
of vaccinated population we have in different pockets of the county. So overall, we're hoping to get to something like 70–80% of the population vaccinated. Of course, that will be more attainable once vaccines available to children. But we're still pushing to get as many people vaccinated as possible. I don't know if that fully answers your question, Chelsea. And I can follow up with some actual numbers of what proportions we can send over those data to you.
Great, thank you, Jamie. Chris Hooks from Capital Public Radio.
Do I need to introduce myself then if you already did?
No, go ahead. I stole your thunder.
Thank you for taking my question. Two of them actually. What is the status on the 2 mass vac sites in 95823? And what impacts are you guys currently seeing now that it's been a little bit of time without the Johnson & Johnson vaccine? What impacts are you guys currently seeing with that in terms of whether or not it's slowing vaccination down dramatically, or even if it's not at all?
So with the large mass vaccination sites, I don't have a whole lot of progress to report. Unfortunately, our contracting process can be a bit sluggish even during emergencies. So we will definitely come back with those updates as soon as we have them. That said, the Pinnell Center, which was kind of originally intended to be a pop-up site, has been having a very, very high throughput and is regularly happening every Friday. And so I don't know if, Mike, you have anything else to add about the Pinnell site, because it's kind of become a large mass vaccination location.
And could you repeat your second question, Chris? Sorry.
Yeah, no problem. Now that it's been some time without the Johnson & Johnson vaccine, what issues have the county run into in terms of vaccinating others? Where, I mean, there was the use of the Johnson & Johnson for unhoused folks. Obviously, some of the clinics there were switched to Moderna, like you guys mentioned last week. But have you guys run into any issues now that it's been some time without the Johnson & Johnson and some of those allocations are just no longer there?
Rachel, do you want to answer?
Sure. Yeah, I can answer that. I think we pivoted pretty quickly to other vaccines for the clinics that we had planned. And I think I mentioned last week, just a lot of collaboration between all of the partners in Sacramento County, not just clinics, but the hospital systems, to make sure everybody had what they needed. So I think we're okay. It will be great to bring Johnson & Johnson back on the table and to move forward again. But I think we've pivoted with our homeless and homebound outreach as well to using Moderna right now. And then having Johnson & Johnson back will be great. But I think we're doing okay with what we've got.
Follow-up question from Chelsea.
Yeah, 2 from me. With the Pinnell Center and the walk-up appointments, are we seeing any waste happening with the walk-up appointments? Are enough people coming in to use up all the vaccine that is there for those days? And then also, is there any information that can be given about the Galt community-based vaccine clinic that is supposed to be rescheduled for Saturday, and how people can sign up for that?
Yes, for the Pinnell Center, we are so fortunate for our partnerships with the community-based organizations and the members and other partnerships within that. So it has been on a consistent basis of helping really register a lot of individuals and community members that face access barriers such as language, transportation, digital. So right as of now, we have been fortunate to have this partnership with them to continue our efforts to sustain that Pinnell. In terms of the Galt clinic, it's happening this Saturday. I don't have the address memorized, and it's from 9 to 2 p.m. And individuals could register. And again, it's utilizing our partnerships with the community-based organizations and the different farms and the city to really do that targeted outreach to make it inclusive and open for the members of community members of Galt.
We could send the address out after this call.
Yeah, I can just tell you right now, it's at the Galt Parks and Rec Department. And I believe that they were still working on a registration link as of last night. There may be new information this morning. Then I have a follow-up from Chris.
Chelsea can ask her follow-up if she wants. I would imagine.
Okay, Chelsea.
Yeah, going back to the Pinnell Center, it was more about walk-up appointments at the Pinnell Center. Are they all being utilized? And I just want to make sure there's no vaccine going to waste, because that was a concern from our newsroom.
I can address that. I don't think there's vaccine going to waste. And we work pretty hard with all of our providers and have from day one that they understand they need to not overdraw vaccine and not that it's unacceptable to waste vaccine. And if you visited that site, they have an impressive system that shows them exactly how many doses they have available, how many appointments are booked, how many walk-ups they can accommodate, and it changes in real time. And so they are in constant contact with their team that is drawing vaccine. So they're careful to not overdraw for what they know is going to, for appointments that they have and walk-ups that are coming through. So it's a pretty fantastic system. And I do not believe there's vaccine going to waste there.
Go ahead, Chris.
Dr. Kasiria, I know you mentioned at the beginning of the month, there was, I'm not necessarily sure if you would consider it a goal, but you did mention that the middle to end of April was probably the timeline for the county to move into a different tier. Looking at you also mentioned that there's possibly that could be sooner if the state meets its 4 million mark of doses in lower quartile areas. But looking at the numbers now, has that date shifted? Is it still late April? I mean, that's probably next week. If it's not, then what do you think the timeline is now?
So in order to get to the orange tier, we need to have a case rate of less than 6 per 100,000. We are averaging 9 per 100,000. So at this point, we are not going to meet our initial prediction or outlook of being able to get to the orange tier by the end of April. And if you do look at our chart on the dashboard, you see that there's a plateau, and we've been in that plateau for quite a while. As I mentioned, it's not due to any major outbreak. It's just due to community spread. We also are aware that we are getting more and more cases of the B117 variant being reported among some of the cases that where that sequencing is being done. So we continue to monitor, and I don't think there's a risk of us reverting back to the purple tier. One, because the numbers have just plateaued. They're just remaining about the same, and also because the state has also changed the criteria for going to the purple tier. So it makes it more difficult to meet all of those criteria to move back. But unfortunately, we will not meet the prediction of getting to the orange tier by the end of April.
Chris, do you have another question?
Yeah, just a quick follow-up on your mention of variants. I know in some places the variants are sort of becoming the more contracted version of the virus. Is that the case right now in Sacramento County?
It's hard to say because we do not do sequencing on every single case. We only do sequencing in certain situations, especially for those that are hospitalized or where we're thinking that this is a breakthrough infection. So it's hard to say, but what I can say from the information that we've received from the state is that a larger and larger proportion of the ones where they do the sequencing are actually the B117.
I do not see any more hands raised or anyone in the chat. Are there any follow-up questions? So just a reminder, I'm speaking of the variance, we did add that metric to our dashboard. So at any given time, you can see how many known cases we have of the 3 variants in Sacramento County. I will send out this recording within an hour or 2, and we have, I think, a few follow-up data points that I will include, as well as the allocation for next week. And we will see you guys on next week's briefing. Thank you.